Many people come to me as clients. They might be very seriously overweight, have so many diet-related disorders, and yet they are very convinced that they eat very well. Why is that? Partly because their doctor never told them that instead of having a cholesterol pill, you could also choose to eat different foods that would lower your cholesterol just as much or more. Very few doctors in this area will ever even engage their patients with that information. Also, people are very convinced that they're eating very well, despite the fact that they have all these diet-related problems because they compare themselves to other people. They're not maybe eating McDonald's every day, so they think they're doing very well. Very clearly that their dietary choices aren't working for them. But they have very little to compare it to. It's always a comparison issue. I had a nurse once who told me, I know I have to eat much better, but I actually eat better than all the family around me. It can be very difficult for one person to embark upon this new path when they have a family that's not supportive, if they're living in a house with other people who are not supportive of that. People need to realize that there's a whole different world out there of possibilities, which in large measure we can work with by understanding our own response to textures, to tastes, different flavors, herbs, spices. And at the same time, we need to decouple ourselves from ultra-processed food. If we can do that, restore our natural experience of taste and food, we can learn to discover what we like. And in that way, we can create our new comfort foods that are healthful and support the planet all at the same time.